Welcome to Prescribing Prosperity with your hosts, John and Alex Soutsos from MedWealth Financial Services, operating through IPC Securities Corporation. In this podcast, we provide unique insights into wealth management, the psychology of financial decisions, and help listeners place the capital markets into perspective. Our aim is to help physicians, business owners, and other medical professionals to live their dream. Life is to live and enjoy, so we'll also cover health and lifestyle-related topics such as food, dining, travel, and unique experiences. Learn how global trends shape our investment strategy as we help you assemble your roadmap to prosperity.
Hello and welcome to the Prescribing Prosperity podcast with your hosts, John and Alex Soutsos. Guys, how are you? Good to see you.
Good to see you, Bill. Nice to see you again, Bill.
I'm excited about this. Full disclosure, I'm excited about this conversation today because I've actually been seeing acupuncturists for about 4 decades now. And so there's a lot of this conversation that happens a lot of the time. And so with that, I'll remind the listeners that in past episodes, you guys have talked about the various aspects of healthcare, from the vagaries of the pharmaceutical industry, God knows that's a nice way to put it, to the challenges of the Canadian healthcare system. And today, this podcast is going to broaden its scope beyond Western medicine and examine the realm of traditional medicine. To help us navigate the subject, we are joined today by Dr. Ashley Chauvin. Did I even get close to that?
Yeah,
Ashley?
like Chauvin. That's perfect.
Chauvin, Ashley Chauvin. For those of you following along at home with this American botching up names, Ashley is a naturopathic doctor at Clarity Health in Burlington, Ontario. She supports patients during active cancer treatment and survivorship to feel empowered and in control of their health. Ashley helps patients understand how they can support themselves through positive lifestyle change, supplements, injection therapy, and to improve the side effects of their conventional care and thrive as survivors. Ashley, welcome. How are you today?
Nice to meet you. Thank you for having me.
Oh, no, I'm delighted. I'm looking forward to listening to this conversation. And with that, John, I think I'll hand this conversation over to a man who knows how to get Ashley's last name correctly.
Ashley Chauvin, good to see you again, Ashley. Just a little bit of background on how Ashley and I met. My wife has a rare form of chronic cancer, and we were looking for something supplementary to conventional medicine treatment, medical treatment. And so I went to the Naturopathic College website and did a search to find someone local in our area. And there's a variety of people who came up, and I was looking over their profiles, and I saw Ashley specialized in cancer. And then I went through a few others, but there was something about Ashley's picture. She had this beautiful smile. She looked eager to help, and she looked like she really cared. So I gave her a call and we went to visit her together with my wife, Lori, and the rest, as they say, is history. Ashley's been looking after Lori for years and years and years now. I don't even remember how many years. Ashley, do you know how many years it is?
Technically, I'm not allowed to confirm or deny who is my patient and who is not, but I was at that clinic for, since 2017.
Yeah, so since 2017 at least. So she started, my wife Lori started with Ashley, and she helped her out with some naturopathic strategies. And Ashley, can you give us an overview of exactly what constitutes naturopathic medicine and how it differs from traditional or conventional Western medicine?
Mm-hmm. So when it comes to naturopathic medicine, I guess it's on a spectrum, right? Like we can say that anybody's practicing naturopathic medicine if they are taking supplements, if they're making dietary modifications. But the way that we see it as a naturopathic doctor would be not just looking at the patient's symptoms, but also looking at maybe some of the underlying causes of why they're feeling that way. We also like to bring in modern medicine by using clinical assessments and lab assessments. And how that differs from Western medicine is what we're allowed to do. So I can't prescribe antibiotics or x-rays. I can't do surgery. But one of the other ways that I think it's very different is I always talk in naturopathic medicine about the line of fine. So if you go to your medical doctor and you say, I'm tired, I'm not really sleeping, and they run some blood work, and your blood work comes up as being okay or not being necessarily like big red flags, they might say, I think you're good, go on, you don't need to see a specialist. Whereas a naturopathic doctor might ask some more questions, spend some more time with you, and try to get you to optimize your health. We also spend a lot of time in the prevention space in naturopathic medicine.
I think that's it's wonderful that you take that approach. Obviously, I've more and more people are going toward naturopathic medicine for a variety of reasons. And in my own case, I've gone that route for my own medical reasons. And what I've come across in my reading extensively is that naturopathic medicine takes a great deal from traditional Chinese medicine and Ayurvedic medicine. And correct me if I'm wrong, Ashley, is Ayurvedic and traditional Chinese medicine one and the same, or are they two branches of the same tree?
They're a little bit different. Traditional Chinese medicine has acupuncture. I'm not sure if Ayurvedic medicine has acupuncture, but a lot of them both work with herbs. They work with mind-body connection as well. And yeah, getting to the root cause of concerns.
What led you specifically to the field of naturopathic medicine? How did you one day wake up and say, this is what I want to do?
Well, it was actually suggested to me by an oncologist, believe it or not. I didn't know what naturopathic medicine was for a very long time, but my parents were fairly health conscious, I would say, and I want to thank my father for that. He was really into weight training. He did weightlifting competitions, so physical activity was really important in our family. My father was also a teacher, so that was his profession, and he would make comments a lot about how children's performance, behavior was tied to their diet. So children that didn't eat breakfast would do differently in school than children who did. My parents were very much focused on what foods that we were eating. For other reasons, I wanted to go into cancer care. I've always wanted to go into medicine and work with patients with cancer. And I did that through radiation therapy. So when I was working in my radiation therapy internship, I would see patients for basically 30 treatments and then say, see you later, we'd never see them again. But there was a very nice oncologist that took me under her wing. And for a semester, I got to follow her around and do a lot of the follow-ups, the survivorship stuff. And a lot of my patients had questions about nutrition, about herbs or home remedies. And this was in Michigan, and naturopathic medicine isn't licensed in Michigan. So it's a little bit of the Wild West. And we're basically telling the patient, we don't know, we don't even know if there's evidence. Maybe it interacts, maybe it doesn't. Right. And I always looked into this stuff. And then the oncologist said, hey, you could probably do a career out of this. This is a thing. Right. So I looked into it and decided to become a naturopathic doctor.
That's fabulous. Now, so you went to Michigan specifically to have this internship. Are you born and raised in the Southern Ontario?
Yeah, so I'm Canadian, but where I lived, and I guess the time of the early 2000s, we could cross the border, back from Windsor to Detroit, fairly easily, and it was very common. So, right. Yeah.
Okay, and it seems. So did you attend the naturopathic college in Toronto, the one at Shepherd and wherever that is, Leslie?
Yeah, so after I made the decision to become a naturopathic doctor, as much as it would be easy to just declare this is what I'm doing, I did end up going to 4 more years of school, and then actually did a residency with patients specifically who had cancer.
Right. Okay. So for many years, there seems to be a perception that naturopathic medicine, or traditional medicine, as it's also known, was lacking in scientific basis. Given the extensive history of naturopathic medicine, why did it suffer such a reputational setback for so many years?
Well, this is I think this is the truth, although it's not probably what I want to admit, but it might have been because of some of the people practicing, right? So for a long time, there was not a lot of regulation, and there was also a little bit of an us versus them mentality. So you had to choose between doing alternative, doing conventional, and that can be harmful. It's also harmful when people are essentially just declaring, I'm practicing this particular way. That causes issues. Currently, there's licensing bodies, there's entrance to practice examinations, there's accredited schools, and a lot of the people who are practicing naturopathic medicine now take an integrated approach and an evidence-based approach.
Can you elaborate a little bit on that phrase, integrative approach? Because you read things about medical doctors or doctors, and they'll say they'll declare themselves an integrative medicine specialist. So tell me what that means.
Well, I'm not allowed to call myself a specialist of anything, so I have to kind of assume what they're saying. And I think it kind of means that they're not choosing necessarily a side, right? So they have their degree, they have their licensing body, but when they're making a decision how to practice, they're not saying I will only give pharmaceuticals. You know, they're also going to talk about nutrition. They're also going to talk about vitamins, botanical options as well. So when I talk about doing an integrative approach in my work, I don't dismiss a patient's family doctor or their specialist. If my scope of practice does not extend to something, I suggest that they get referred back to their specialist. And I also have a conversation with them about if they're offered something by their family doctor and they're looking to me for, we'll say, an alternative, is it actually an alternative? Is it equal? So having those conversations with people, not really choosing one or the other, working together.
In your opinion, what's led to the recent increase in popularity or acceptance of naturopathic medicine?
I would like to say it's more people having a positive experience telling other people. I also think it has to do with more regulation, better care for patients, and making sure that the public is protected so that we're not hearing of these stories of people being harmed.
Do you think it has much to do with a level of frustration that people are experiencing with a conventional system that's in place?
That would not surprise me. Yeah, I think that sometimes people come to me, not in the cancer space, but maybe in general practice, almost like they feel dismissed, or they're just taking like a Hail Mary approach, and then they get helped and they're like, oh, maybe there's something to this. So
I know from speaking to my clients, people are experiencing health crises and are going to conventional medicine, and it takes them to a certain point in treatment. And then they say, well, is there anything else? And conventional medicine does not have a response. They say, well, take these drugs and here's a surgery you can do. And people are frustrated and they're looking for more. They're looking for something else. And so I find out that they're going to naturopathic doctors as well, and they are integrating their treatment without telling the conventional medical practitioners what they're doing, because they know that the conventional medical practitioners are going to be dismissive of the patient doing that. So it appears as though there's been some tremendous progress in the last decade, but we're still not at the point where there's open cooperation. Alexander? Sorry, go ahead, Ashley.
I was gonna say that I guess some of my patients are pretty lucky. I do write quite a bit of letters to family doctors or specialists telling them about what I'm doing with patients. And thankfully, I've had a lot of positive responses, more positive than negative. But I do agree that not every maybe medical doctor is comfortable with their patients pursuing naturopathic medicine as well.
Well, I think this might be a good opportunity, Dad, because you had talked about some of the origins of traditional medicine, or what we would consider traditional Western medicine, I guess is the better phrasing for that. So did you want to touch a little bit upon that in terms of perhaps why the historically, and maybe like Ashley mentioned, the perception is changing, but why historically average medical practitioner that a patient would deal with would have been so dismissive and not as open-minded to the practice of naturopathic medicine?
Well, I can't say I'm an expert in this, but I have done extensive reading. Anyone who knows me knows that I like to read and research various topics. And what I've come across is that the very famous John D. Rockefeller, who created his wealth in oil, in the early part of the 1900s, discovered the opportunity to make a lot of money in the field of selling drugs. And so he began by purchasing a German pharmaceutical company, and then decided he was going to put some money together with another fellow successful industrialist, Andrew Carnegie. And they started creating and funding medical schools all over America on the strict condition that they taught only what they called allopathic medicine. Now, allopathic is a Greek word, means other treatment medicine, and that's because I believe that naturopathic medicine, as we call it today, was actually the conventional medicine prior to the early part of the 20th century. So part of their strategy in mainstreaming allopathic medicine was to discredit their competition, and they used propaganda techniques through the media to discredit what used to be in place. So a bit of an unpleasant origin to conventional medical practices. How robust this information I've read is, I don't know, but that's what I've learned and looking at a little bit of the history. There's a lot more to be said beyond what I just said, but that gives a little bit of background.
Yeah, I think there's more to it than just the from what I was able to research as well. There's more to it than just through the media channels that they were discrediting traditional medicine or naturopathic medicine. It was in the way that the educational system was funded. So they lobbied the American Medical Association to only grant medical degrees and medical licenses to people who practiced allopathic medicine.
I think
then
they actually organized the American Medical Association.
From what I read, it sounded like it was already in existence, but regardless, they lobbied or created, whichever path you choose to follow, a system in which it basically became a monopoly for obtaining a medical license. And so what ended up happening was they funded a whole bunch of universities and their medical programs by providing them with millions of dollars in grants. And you have to understand, this is in the early 1900s when millions of dollars were, not that it's insignificant today, but it was massive money for those universities. They provided them with a significant windfall in order to practice and teach only this type of medicine and not teach traditional medical and naturopathic medical practices. And so it over time phased out a lot of the practitioners who would have otherwise practiced that type of medicine, and it became established and became the norm of allopathic medicine was the only type of medicine that should be practiced and became accepted by the public. But anyway, that's as you said, it's a topic that's like we could go fairly deep on and get into it another time. But anyway, going back to our discussion, Ashley, generally speaking, the patients who reach out to you and who are looking for naturopathic medicine or naturopathic assistance, what type of treatment are they looking for? Like, what's the typical intake process for a patient at a naturopathic clinic? Are they usually looking to treat an acute illness, or are they looking for more preventative or general wellness type of services?
Most of my patients are looking for support for a chronic condition. And I would say that's because the way that my practice is set up, I'm working with patients who currently have cancer, a history of cancer, who are in medical menopause. Those are very chronic conditions. And for the acute conditions like pneumonia or an illness, they're generally seeing, their family doctor or a walk-in clinic. So again, that's my practice. In terms of the intake process, one of the main differences between what I do and maybe, a specialist or a family doctor is we spend at least an hour at the first appointment. And it seems like a long time, but that hour goes by pretty quickly because I'm discussing their medical history, like the barriers to their health, their current health concerns. And then I really want them to articulate what matters the most to them, right? So like, if I could fix one thing, what would be the most important outcome? And that's important because from there, I can develop a strategy and I can figure out what's bothering them, how they can be supported, and also keep them accountable for their health goals, because chronic conditions also require sustainable long-term solutions.
Absolutely. It makes sense. One of the things that I seem to, and this could be, it could be strictly just my own personal perspective or experience, but it seems like a lot of people reach out to naturopaths because of intestinal distress. Like that seems to be one of the most common pathways that lead you to a naturopath. Is that the most common catalyst for somebody consulting a naturopath, or is there other more acute items that generally lead them towards you?
Well, for me, I do work in a clinic where there's a lot of other providers. So there is somebody at our office and she does a lot of GI care. I have somebody else who does a lot of fertility care. And then a few of us work with hormones as well. Yeah, GI does play a huge role. And the thing about GI distress is that's a chronic condition. Generally, the acute issues are resolved, but there's a lot of things about GI care that we still don't know or we don't have good solutions for. So people are unhappy with the solutions that have been provided for them. So they are seeking care for that.
Right. So, I noticed I was browsing through your link tree when we were when I was prepping for the podcast, and I noticed there was a link for a GI summit outlining the myths of the microbiome. What are some of the common misconceptions that exist relating to gut health, as it were?
Yeah, that summit was last week. It was really fun. I was one of the guest interviewers. So there's a ton of common misconceptions related to gut health. Probably the top ones for me would be that everybody has parasites, everybody needs a detox, gut health can be like a quick fix, and restrictive diets would be probably my number one myth, that
Okay.
restrictive diets are helpful.
Okay, good, because that's something that we're gonna touch upon in a little bit. But I assume then that you are not a fan of the general perspective that something like the appendix is just a vestigial organ that has no place in the health system for a person.
Well, if it's not causing problems, I think we should leave it well enough alone, like
Yeah.
most other things.
Yeah. The reason why I asked that is one of my best friends, she had some GI issues when we were in university, and it kind of followed a period where she had an infection, and then they removed her appendix, and she was being given a high dose of antibiotics, a variety of different antibiotics, and basically for the next 3 to 5 years is my recollection of the time period, at least 3 years she could not eat properly. Like she went from being, a fairly healthy individual to looking like sickly skinny in terms of her physical appearance. And it was because her body couldn't process anything. The combination of the antibiotics and the elimination of her appendix basically left her with no gut microbiome and no bacteria to break down certain foods. And so it took her several years to build back up her tolerance, her body's natural ability to process certain foods like meats and other things. And so it was a very challenging journey for her. And that was one of the first times that it kind of came across my consciousness about how important your gut microbiome is and how important it is to maintain that.
Yeah, that's a hard thing for your friend to go through. And I think we're about the same age. So in terms of like what we knew about gut health then and what we know about gut health now can change. But there
Hmm.
is this phenomenon that is really only slowly being recognized now. And it's about like post-infection
Hmm.
IBS, where essentially when we digest things, most of us actually don't feel it. Like we don't feel our digestion. We shouldn't feel gas being produced. But after we have an infection, the nerves, like the nerve cells in our guts get like really hyper responsive.
Hmm.
So it lowers our pain threshold and we can have all of these experiences that we're not supposed to have. So it
Right.
can make things really challenging.
Absolutely. And from just a pharmaceutical perspective, when people are prescribed high doses of antibiotics, how precise is the antibiotic and only targeting the specific infection that they're targeting? How common is it for it to affect other forms of bacteria in your body, the good forms of bacteria that we need?
I'll be honest, gut health is not my specialty, so I might not be the best person to answer this, but we do
Okay.
know that it's antibiotics they don't always pick and choose, we'll say, depending on the type of antibiotic.
Right. Absolutely. Okay. So in terms of from a health standpoint, how much of what we experience is impacted by our daily food consumption?
So food is so important. And I think one of the big things that people make a mistake in is just like so we'll say under fueling. So not getting enough protein, not getting enough fiber, not getting enough adequate carbohydrates, and having a good balance of all three of them. Just like in your case, if people don't have their savings, they're going to have some problems in the future. We see that during the day. Anybody who has a child knows that if you don't feed them breakfast, they're going to get pretty hangry. It can happen to adults as well. So
Right. Absolutely. And so, you touched upon it a little bit earlier. I want to get into it a little bit more now, if you don't mind. Let's talk about elimination diets. I know your answer now. How effective are they? But are they really necessary? And what is the impact of them on a long-term basis? Can sensitivities be managed or overcome over an extended period of time? Like, what would be your perspective or your deeper belief on elimination diets?
Well, I'm really glad you're asking this question. And I would say this is one of those things about how you know more and you practice differently. And I think my colleagues would feel the same way. When I was in school, we were taught just put everybody on an elimination diet, full stop, do a food sensitivity, just take things away and people will feel better. And initially, this might work because most of us in North America are living on a standard North American diet. So if we take some food away, that might mean that they're cooking whole foods at home, right? Or
Right.
they're eating more vegetables and maybe eating more lean protein. So they're going to feel better. But over time, we actually see that the research shows otherwise. And part of the problem with the elimination diet is that it can create a really disordered relationship between your food and how you're feeling. Because with an elimination diet, you're really only supposed to do it for 4 to 6 weeks maximum and then start adding things back in. And because people feel well, they don't want to add things back in. But if they haven't gone to the root cause of why they're not feeling well in the first place, and very rarely, unless it's, celiac, we're not just going to blame one thing like gluten. People just end up taking out more and more and more and more. And then they're underfueled. They don't feel well. They have nutrient deficiencies, and it's not good.
Absolutely. My father-in-law right now is he was undergoing an elimination diet, trying to determine that, and what you just said kind of really speaks to his experience right now, because he keeps cutting out these different things, and he's trying to figure out what it is, and it seems like it's becoming further and further and further restrictive, and he hasn't really settled on what the root cause is yet. And so it is definitely a challenge for people to try and utilize that to figure out or pinpoint what exactly is the cause, because like you said, it could be a combination of different things. It's not just one specific item. Would you encourage people to then microdose, if for lack of a better term, once they identify certain items? And maybe, if it's something like let's set gluten aside for a second. If it's something like they're having difficulty processing lactose or cheeses, milk and dairy products, would you recommend that they reintroduce it back into their diet in small doses in order to build back up a tolerance so their body can still consume it on a regular basis?
Yeah, that's definitely one way. It's tricky because with food, there's like the gamut. I'll use lactose. It's a great example. There's the glass of milk versus cottage cheese versus,
Right.
Greek yogurt and then hard cheese. And some people will tell you, if I have a glass of milk, that's not good. But if I end up having, some cheese, I'll feel okay. We also have to think of what people are eating with that particular food and how much of it they're having, right? If you're having a whole brick of cheese, regardless if you are lactose tolerant or intolerant, you might not feel the best that you can be,
No
but
kidding.
generally people may be able to add things back in if it's not a true allergy.
Right. And what about the celiac thing seems to be something that has become very prevalent in the last, I don't want to call it, 10, 15 years or so. Is there an overreaction in a way to it? Like, are fewer people truly celiac or gluten intolerant than they necessarily believe? Like, how many of them are self-diagnosed, versus they've actually gone through and got a diagnosis from somebody like yourself or another naturopath to say, yes, you actually do have a gluten sensitivity.
Yeah, gluten's a tricky one because when we're looking at celiac, it's actually an autoimmune disease.
Okay.
So it's in a completely different category. And because gluten is in breads and there's other fermentable fibers that we see in, I guess, like things that would contain gluten, it's
Mhm.
sometimes hard to distinguish between, is this a gluten problem or am I having too much of the fermentable fiber? And
Right.
most people actually react worse to the fermentable fiber than they do to gluten, but
Okay.
it's really hard to distinguish unless you're doing like a placebo-controlled trial where you're giving people blinded gluten versus blinded something else. And they have done those trials as well. And they see that the amount of people that react to true gluten isn't as high as we think.
Mhm.
However, having said that, you know, we do, when we are eating foods that contain gluten, they can sometimes be these simple carbohydrates, and having a lot of them might not make anybody feel too well. So it could be the amount that they're having, and then they take away, their pizza, their burgers, their Kraft dinner, and they start
Mhm.
to feel a little bit better.
And that's kind of my perspective on it. And I'm not trying to be insensitive to people who do obviously suffer from celiac disease, but it would seem, based on the way our diet has evolved over the last 50 years, where it's much higher in carbohydrates, simple carbohydrates compared to proteins and fats, that it would be, like you mentioned, more common that the issue stems from overconsumption of those simple carbohydrates as opposed to true sensitivity to gluten itself. So we'll give you. I got two follow-up questions before we're going to wrap up our part one here. But the first one is, what are some of the common causes of bloating that an individual experience?
So surprisingly, bloating's a much more loaded question than a lot of people think it is. When we talk about bloating, we have to distinguish between, is this the sensation of like fullness, gas inside your abdomen, or is this distension? So that's when your abdomen actually puffs out. And those are two very different things. But in terms of like maybe why people would have distension, if they are somebody who is a woman, hormonal fluctuations are a big one. We have to look at some gynecological things in their uterus and ovaries, like endometriosis or fibroids. We do know that stress can slow down the digestive process. It can slow down movement in the colon. We know that individuals who are constipated are definitely going to feel more bloated. Small intestine bacterial overgrowth, that one's not as common as the media would like you to think it is, but that can be, I guess, a small cause of the bloating and distension. And then we kind of touched on it earlier, but that post-infectious issue that somebody can have where your nerves become hypersensitive and you're actually feeling that digestive process happen. And that's for most people what it is. We're not supposed to feel our digestion at all.
Right. I can definitely speak to that. If I have an overconsumption meal, we'll call it that, where I'm eating too many things that I probably shouldn't be eating that are not healthy foods, you definitely feel the bloating afterwards because it almost feels like your body is just like oversensitized to everything. So I can picture it in my mind exactly what you're describing.
This is why gluttony is one of the 7 deadly sins.
Yes, unfortunately. Anyway, the what are some of the warning signs of serious gastrointestinal distress, Ashley?
Yeah, so those are the red flags that we do want to pay attention to. So when someone's losing weight for no reason, when someone has low iron for no reason, that would be seen on blood work. If you have symptoms that wake you up in the middle of the night, if you are vomiting blood or vomiting, or if you have blood in your stool, if you're having severe abdominal pain, and and I would also say if your symptoms are affecting your daily life, get it checked out, talk to somebody. I have a zero tolerance for dismissal. And I let people know, like, if this is affecting your life, it needs to be dealt with.
Right. I think that's a great point, because ignoring it is not going to resolve the issue. I think this is a good point to take a break here, Bill. So I'm going to throw it back to you, and we're going to continue this conversation on the other side of the break.
That is great, and we look forward to having you back, Ashley, for this really terrific conversation. Before I wrap up, John, Alex, let's close this out like I always do. What's the best way for anybody to get in touch with you? We'll get Ashley's stuff next time.
Absolutely. So for us, the best way to get in touch with us is to go to our website, which is medwealth.ca, med-wealth.ca, or send us an email at info@medwealth.ca.
That is fantastic. And for those of you listening to this podcast for the first time who are not subscribers, let's just fix that. That's easy. Just hit the follow button, hit the subscribe button. That way you're notified every time John and Alex drop a new episode of the podcast. You can listen to it. And I would ask, if you like this podcast, tell people about it. Just let people know. Word of mouth promotion is terrific. Until next time, and part 2 with Ashley, I want to say thank you for taking the time to listen today, and remind you that you can go out today and make today a great day, or not. It's your choice. Thanks so much for listening. Until next time.
Thank you for listening to Prescribing Prosperity. Visit our website at med-wealth.ca. That's med-wealth.ca for more information or to connect with us for a consultation. Don't forget to click the follow button to be notified when new episodes become available. The information covered and posted represents the views and opinions of the hosts and their guests and does not necessarily represent the views or opinions of IPC Securities Corporation. The content has been made available for informational and educational purposes only. The content is not intended to be a substitute for professional investment advice. Always seek the advice of a qualified and licensed financial service provider with any questions you may have regarding your investment or retirement planning. MedWealth Financial Services can provide a private consultation to help you determine the suitability of any guidance discussed on the show.